my obligations to say things that are true to Philadelphia and to keep my promises. And I had said when I announced this, that if we didn't see hospitalizations rising, that we needed to rethink this and that we shouldn't have a mandate in that case. So that's what we're doing today. And, it is a very short span of time because that's the time we needed to see what was going to happen next. We didn't want to miss the chance to interrupt a serious wave. But with hospitalizations coming down, we feel comfortable saying, this is not a free-for-all, take off your masks. This is we're going to strongly recommend this rather than require it, because that is going to work in Philadelphia right now. I would disagree that it's been confusing. I think that most Philadelphians have understood that there was a mask mandate and why. And I think that's what we're seeing in the data. If people hadn't understood that, I don't think we would see Philadelphia data moving in the direction that it's moving, given that that's different from the surrounding areas. Cases remarkably quickly lowered in Philadelphia, flattened out, and hospitalizations went down. And that to me says people are listening when we tell them to listen. So, part of our ability to get people to listen when they need to is to tell people when things are getting better as well, and not to be more restrictive than we have to. What I'm trying to do is really follow the data. And I think that's what we've done here. I've said, and I said when we announced the mask mandate, that if we didn't see hospitalizations rise in tandem with a rise in cases, that we would need to change and rethink our metrics. And that's what we're doing here. Hospitalizations peaked at 82 on Sunday, on Monday down to 77, on Tuesday down to 74, and yesterday down to 65. That's clearly not a rise in hospitalizations. And I think it just doesn't justify keeping a mandate in place when we don't need one. I think that what we're seeing, though, is not the impact of the 3 or 4 days of enforcement. I think that we're seeing also the week before that in which that was announced. We wouldn't see hospitalizations going down already as soon as Monday and Tuesday based on enforcement that started on Monday.